Minister Mark Butler called them arguably the most reliably accessible health professionals in our community. These are our pharmacists, but the pharmacists upon whom praise was heaped for carrying such a huge chunk of the load during COVID now find their industry under attack from the Albanese government. The proposal seems like a simple one.
So that patients who are very stable in their condition and have been on these medicines for some time will be able to get a supply of their medicines with only one visit to the GP per year instead of 2, and only 6 visits to the pharmacist instead of 12.
Now, of course, there's nothing stopping a person with a prescription from right now getting it double dispensed in a single visit so that they have a medicine supply that can last them longer. So what's really going on here? To understand that, we have to know how pharmacists get paid. They don't get a percentage of the value of medicines dispensed, for instance. They get, instead, a flat fee for the task of dispensing. That's to make sure that you don't get more time and good advice for buying an expensive medicine over getting a simple one, because all Australians deserve to get quality health advice from their pharmacist. So it's structured as a fee for providing the service of dispensing 30 days worth of medicine. So what's really happening here is that the government wants to halve, in effect, the amount that it pays pharmacists to do their work in our communities. Because instead of being paid for every 30 days worth of medicine they dispense, it'd be a payment per 60 days worth. Now, the government says it is a win for consumers.
This will obviously involve much less inconvenience for patients. It will reduce pressure, which we know is substantial on general practice, and importantly, it will halve the cost of those medicines for 6 million patients.
That's really only one side of the story. The good advice and accessibility of pharmacies is often all you need to sort out basic medical problems, and by making pharmacies less financially viable, there will be fewer of them, especially in the places that need them most. So that's likely to mean more people needing GPs or even hospitals to deal with matters that pharmacists currently handle well. Now, it might save the taxpayer a few bucks in the short term, but if it forces us into GPs' offices and the more expensive taxpayer subsidised bulk billing rates that come with it, it's ultimately going to cost the taxpayer more. And it will take a lifeline out of rural and regional communities who already have too few general practice and hospital services. That would be a hopeless false economy and yet another betrayal of the bush and of the small businesses that have been let down once again by Labor. Now, because there are limits on how many pharmacies a pharmacist can own, they are usually small businesses. President of the Pharmacy Guild, Trent Toomey, broke down in tears talking about his battles with Labor about this.
If those spin doctors down there don't want to believe what I've got to say, get off your ass and go and talk to these guys, right? I've had Labor Party senators and MPs just take their phones off the hook because they don't give a right? I'm sorry, I'm a North Queenslander, I don't mean to swear, but they just don't care.
Now, this policy change was recommended by the Pharmaceutical Benefits Advisory Committee. That's a board consisting of doctors with the role of advising government. But it consists entirely of doctors. There's no community pharmacists on it. And ever since a trial began for pharmacists to be able to provide common medicines without needing as many prescriptions, there's been something of a turf war between doctors and pharmacists. Doctors don't like that trial because it means there will be lower demand for them to do the simple tasks that make something of an easier dollar for them. But consumers have long been frustrated by the requirement to get scripts for medicines they know well, that they've used without difficulty for the long term, and they've been irritated by the paternalism that assumes they won't go and see their GP if something changes or if it's no longer working for them. That turf war's descended into the ugly, with the Royal Australian College of GPs president, Dr Nicole Higgins, tweeting gleefully at having been, quote, a disruptor to pharmacists. Here I was thinking it was all meant to be about patient care. Now, they might dress it up as being all about patients at election and budget time, but the doctors' lobby is, just like every other union, a pretty self-interested bunch.